Professional Employment and Training Program is part of the Center for Women in Government and Civil Society, and we provide technical assistance, knowledge sharing to all Perkins grantees, those community colleges across the state that receives Perkins grants from New York State Education Department to recruit and retain students to gender non-traditional fields of study. And these are fields of study where there is less than 25% of either gender. So we host monthly webinars that are free and open to all Perkins grantees, and we address different topics on recruitment and retention of students pursuing gender non-traditional fields of study. And all of our webinars, the recordings for all of our webinars are mounted on our NET website. So please feel free to go there. It's www.netprogram.org. And so today's topic is nursing and making the profession gender neutral. So nursing has been part of course, the female-dominated occupation, and it's a field that has made great strides in recruiting and retaining males to this historically female-dominated profession, which is still really female-dominated. We'll hear from our expert speaker, distinguished speaker, a little while later. And so we have not reached parity yet in terms of numbers in this profession. However, the fact that it has made great strides in recruiting males and bringing some level of parity to the field makes it a leader in that space. And being a leader that has successful strategies and lessons we can learn to replicate in other fields that are gender dominated can help us all really overcome this equation. And so to help us make sense of the struggles and the triumphs in the field of nursing, we have an expert with us today. And we're extremely honored and excited to welcome Dr. Susan LaRocco. And Dr. LaRocco has been a nursing educator and administrator for more than 30 years. Most recently, she was the interim dean of nursing at Mercy University in Dobbs Ferry, New York. And prior to that, she was the inaugural dean at Mount St. Mary College in Newburgh, New York. Her dissertation was a grounded theory study on recruitment and retention of men in nursing. She has been an active member of the American Association for Men in Nursing for many years, including having served on the board of directors and as chairperson on various committees. She's presented on the topic both locally, nationally, and at the state level, and has published extensively on clinical topics, as well as on the topic of men in nursing. And currently, she is continuing her research on the Alexian Brothers Hospital School of Nursing and all-male nursing school in Chicago. And please help me welcome Dr. LaRocco, who's going to share some insights with us, and then we'll open up the floor to your discussions with Dr. LaRocco. Dr. LaRocco, the floor is yours.
Thank you for that kind introduction. And I see we've got our slides now too. So you can hear me okay, I hope? Good. Okay. So first of all, I have to tell you how pleased I was when Esther called me and asked me if I would be interested in talking to you as a group. This is one of my favorite topics. I'm very interested in men in nursing. Originally, I was teaching in an associate degree program here in Boston, Bunker Hill Community College. And when I was teaching there, one of the things I noticed is there were, first of all, not many men in the class, but they were always significantly older, whereas our students, sometimes the female students were right out of high school, although many of them were immigrants and older themselves as well. Our male students came to nursing at an older age than the typical female student. And that's particularly true in traditional college settings, traditional associate degree programs. And so when I entered my PhD program, I decided, since it was policy focused, I was going to do my research on men in nursing from the policy perspective. One of the concerns from the policy perspective is the loss of talent. When you educate someone in a profession when they're 25 years old, you're going to get 40 years probably out of them in terms of return on the investment of the education, both for them personally as well as for us as a society. So when you educate people into a profession at a younger age, you get more years of work out of them. So when our male students become nurses later in life, we're not really getting the bang for the buck, you might say. Although I'm not saying we shouldn't educate people later in life, but if we could have young boys see nursing as a career, it would be it would increase the workforce of males in nursing, and also those people would have more years of learning and earning from their profession. So if you could advance to the next slide, Esther. I'd like to go into a little bit of trivia, a little bit of background to provide some context for what we're talking about. And I recognize there's often differences where you're located. If you're in an urban area, if you're in a rural area, some of the things are slightly different. In particular, if you're in a more rural area, you don't have as many clinical sites available to you. If you're in an urban area, you may have a lot of sites, but you also have a lot of competition from other schools. So you'll have to kind of wrap your head around sometimes what I'm talking about and put it into the context of whether you're more rural or more urban area. So one thing that we're very proud of in nursing is that over and over in the annual Gallup poll, nursing is rated as the most respected profession, and often many percentage points ahead of the next closest one. The highest ever that any group got was in 2019, and that was where 85% voted that nursing was high or very high trust rate. But consistently, every year when the poll comes out, nursing people wonder, are we going to still be on top? And we just keep sitting there. And way ahead also of even the other health professions. And I don't want to tell you where your congressmen fall. They're way down at the bottom. So next slide, if you would. And some information about the workforce. Now, the National Sample Survey of Registered Nurses is done about every 4 years, and I have not seen the analysis of the most recent one. I looked again yesterday, and I still don't see it showing up. So, but we're looking at over 3.2 million licensed and employed nurses in the country, and this is just RNs. One of the things you want to watch when you're looking at statistics, sometimes they'll tell you how many licensed nurses there are, and sometimes they'll tell you how many licensed and employed. And because some nurses who are licensed have dropped out of the workforce for a while, perhaps to raise a family, perhaps to pursue some other employment, or some of us retired nurses still keep our license because we're not quite sure we're really ready to be retired, and we always think we might go back to do something in nursing. So always watch your statistics to see what they're talking about. Occasionally when they say nurses, they actually mean RNs and LPNs too. So if you see other numbers, don't be surprised. In 2018, only 10% of the employed and licensed RNs were male. I would say I've seen statistics now of 11 and a half, 12, so it's creeping up. Back in the day when I was in nursing school, it was more about the 1%. That's now a long time ago, but My class, I'm from Buffalo General Hospital, diploma program. We graduated 78 of us, and there was one male in our program. So now at least we are seeing more. And then if we could go to the next slide. One thing that is noticeable, though, is that the percent of the RN workforce under age 40, there's significantly more men than women. And so I just told you men come to nursing later. So does this make sense? Well, I think it's particularly reflective of the fact that there's so many older nurses that graduated in the 80s and 90s when there were almost no men in the program, particularly in the 80s. So I think it's encouraging that we see a higher percentage of men who are under age 40, because we're likely to see them continue in the nursing workforce for a longer time. So from that standpoint, that's, I think, encouraging. The next slide, please. So the job outlook, which is always something we're interested in when we think about our students, we want them to be able to graduate and go into employment right away. Nursing is really a growth occupation. They're expecting significant growth for the next 10 years, and on an annual basis, 193,000 openings projected each year. This is reflective of a number of things. You have an aging population, which is demanding more health care. You have an aging workforce in nursing, which means more retirements. And because nursing is not only intellectual work, but also very physical work, oftentimes older nurses find that they can't continue to work or can't continue to work full time because of the physical demands. This has become particularly true with the trend towards 12-hour shifts. A lot of the older nurses will tell you, and by older I mean 55 and older, that a 12-hour shift is very physically demanding and difficult for them. Whereas the more traditional, in the old days, 8-hour shifts, people could handle a little bit better. But the 12-hour shifts have become so popular that any hospital that tries to stop them has just about a revolt from the nursing staff. The cut down on the commuting time, the more days off to attend to family life, has become very popular. So job outlook, very favorable for nursing, for all nurses. So let's go on to the salary information. So this is, yeah, don't bring in the next one yet. So did you know, what do you think the annual mean wage for nurses now is in New York State? Can put it in the chat or just write it down, unmute yourself, say what you think. Any idea? Come on, somebody be brave.
Around 90,000 or so, maybe
I
more.
see 85,000, 90,000. Any others brave enough to make a guess? Go ahead, Esther, bring it in. And then the next is the citation for that. So this is government statistics. Yeah, wow. I have to say, even I have said, wow, this is for New York State. There are other states that are higher. When you look at it for the nation as a whole, it's significantly less, but we know the southern states pay less. Some of the more rural states like Idaho, you're not going to find the salaries, but this is for New York. And so how about the next slide? I'm going to read this to you because I think it's astounding, and then I'm going to tell you where it comes from. This was an ad. New RN grads can start prior to taking the NCLEX, the licensing exam. They have a 6 weeks transition to practice program which includes didactic and simulation and practicums. And then I didn't identify the hospital. Will reimburse up to $550 for an NCLEX review course and fees for getting their license. And this is offering them a salary of $105,502. These are new graduates, not even licensed yet. So where did I get this? I was most recently, until last June, the interim dean at Mercy University in Dobbs Ferry. We have a campus also in the Bronx. And this is a hospital in the Bronx, one of the major medical centers, sent this to me and asked me to distribute it to our graduating seniors, where they were being offered a salary of over $105,000. I was, quite frankly, astounded. In the past, most places wouldn't even consider hiring until the person was licensed. And here, not only were they going to pay them right from the start before they were licensed, they were also going to reimburse them. Go ahead, Melissa, you have a question?
Melissa, we can't hear you.
Let me try something. I'll be right back.
I'm
Maybe
sorry.
you can write it in the chat and then we can grab it later.
What we got here in the chat. Oh. Yeah, it's frustrating, isn't it? About the BSN differential. What I thought was extremely interesting is, first of all, it's not a very big differential, but that they were actually recruiting non-BSN nurses. So I would have expected that they wouldn't have even mentioned it, but that means they clearly do have associate degree nurses and would still be recruiting them. The hospitals that have magnet status, which is a designation, a voluntary designation, allows or encourages them to have an all BSN staff, but realistically, that's not always possible. And yes, New York State, about 3 or 4 years ago now, the former governor signed into law a BSN in 10 law, but that meant that people could graduate from an associate degree program and have 10 years to get their bachelor's degree. And anyone who already had a license was grandfathered in, and anyone who was already in an associate degree program was grandfathered in. And as of last spring, they had really not written the rules and regs related to this, but the person wasn't going to lose their license after 10 years. They were going to not be able to practice until they completed the BSN. But there's just so many opportunities for students to do their BSN after they do an associate degree, online programs all over the place, and many of the employers are paying for it. I recently had some experience at the VA hospital here in Boston. And of course, as an educator, I'm always asking people, where'd you go to school? And several of the nurses that I talked to were completing their BSN online while they were employed at the VA hospital. The VA was paying, the Veterans Administration, paying their full tuition and giving them a stipend for their books. So for an associate degree nurse, there's plenty of opportunity and financial support for that. So, but I thought, I have to say, I was astounded when I opened my inbox and had this from this major medical center asking me to send it around. My faculty were not making those kinds of salaries with their doctoral degrees. Can we go to the next one? So I want to give a little historical perspective related to men in nursing. Actually, the first nurses were men. medieval times, military and religious nursing orders were all male. The Templar Knights, the Knights of Malta, the Alexian Brothers in the Middle Ages. And it really wasn't until Florence Nightingale, went to the Crimea during the Crimean War and cleaned up the hospitals and improved the sanitary conditions and all so much, that there was really any thought of women being nurses. Before that, any women that went into nursing were more like maids or attendants to psychiatric hospitals or things like that, not certainly a profession at that time. And Florence did, our old friend Flo, as she's known in nursing. She started the first school for nurses at St. Thomas Hospital in London in 1860, and she referred to it as respectable employment for Victorian women. And in the US, most of our diploma programs were modeled after Florence Nightingale's school at the St. Thomas Hospital School. And so she basically said men shouldn't be nurses, made no accommodation for allowing men to go into nursing. And this became very quickly the norm. So we went from a time when all nurses were men to a time when no nurses were men. And so then to the next slide, little bit more history, that there were several all-male nursing schools, though, in the US, and typically they were affiliated with psychiatric hospitals. Because at one time, when there was no real treatment for mental illnesses, all they really cared about was the brawn. And so they had schools for men, and but they were almost always in a psychiatric hospital. The Alexian Brothers were particularly unique, though. They started a hospital school of nursing in Chicago. They were a German order. They had been around since the Middle Ages. They were considered to be a nursing order. And so when they came over to the US, they started a nursing school after they opened their hospital. They found that they wanted to have men, particularly the brothers, better trained than they were. At various times, the Alexian Brothers Hospital School of Nursing only accepted religious brothers. At other times, and most of the time, they accepted both religious brothers and laymen. Not only were they an all-male school of nursing, until the mid-60s, they were an all-male hospital as well. So the men who were socialized into nursing there had a totally different experience than the one man who might have been accepted into a female diploma program. Many of the schools, the diploma programs in the US, would not admit men. I've done a lot of interviews with the Alexian graduates in an oral history project, and the number of times they said to me things like, well, I wrote to all the local schools of nursing, and most of them didn't even reply, and those that did said, we don't accept men. It's almost hard for us to imagine that level of discrimination, of gender discrimination, which wouldn't even be legal today, but at that time, no one really questioned it. So that gives us some context of why there are so few men in nursing. Can we go on to the next one? So now I'm going to ask you to tell me what you think. When I say nursing or nurse, what words come to mind? Stick them in the chat and let's see what you're thinking when we say nurse or nursing. Caregiver, true. What else? Responsible. Effective communicator, that's a really important role in nursing. Hardworking, multitasking, good under pressure. Good, good. Caring, good, thank you. And empathy, empathetic and caring, helper, good. I'm glad to see none of you say nice girl. I've had people talk to me about how they have a relative that, or a friend or whoever, who they're encouraging us to admit to our program because they're, quote, a nice girl. And I think being nice is important, but you also need to be pretty smart too, and be the things that you described, empathetic, good communicator. So let's go on to the next slide. Sure, Melissa, I get it. It's so frustrating, isn't it, when you have trouble? So to give some context to where we should intervene to increase recruitment and retention of men in nursing. This is from my research, the 4 stages of socializing men into nursing. We're really only interested in the first 3, so I'm not going to talk about the things I learned about being a nurse. But prior to considering nursing, when they weren't even thinking about it, one of the things that came through from all of my interviews is the lack of recognition of nursing as a career choice. It didn't even hit people's radar screens. Men who were nurses were saying when they were younger, it never even was something they thought about or anyone suggested to them. As they chose nursing, though, what were the things that appealed to them? The opportunities, the fact that there were so many chances for a variety of work settings, a variety of types of nursing, a lot of opportunity for advancement, being anything from an educator to a clinician, to an administrator. So those opportunities, as they learned about nursing and saw opportunities, they became interested in choosing it. And then family and social influences were extremely important, particularly knowing someone who was a nurse, a family member or close friend or relative. And the other thing that influenced a lot of men, the social influences, the number of times men said to me, my friend was in a motorcycle accident and I went to visit him and I saw what nurses really did. So that socialization to the role of the nurse was extremely important. So let's see how we can use this information to enhance recruitment and retention of men in nursing. So let's go on to the next slide. And so here's the problem: recruiting and retaining male nursing students. Let's talk about recruitment next, if you would go on to the next one. So lack of information from guidance counselors. And I think even though my research is about 20 years old now, I see it often quoted, I see it used as the basis for additional research. And over we still see guidance counselors do not have good information about what nurses really do, about the job opportunities, about the salary potential. If we were to poll all of the guidance counselors in your pretty much your catchment area, I bet you would find most of them did not have the information that you have just from what we talked about already today. So lack of information, lack of guidance from guidance counselors. I even had men tell me that they went to the guidance counselor and said, I'm kind of thinking about nursing. And they were encouraged to consider something else like physical therapy. It's a better job for a man. So we really need to work on that piece of it. The lack of role models. And this goes back to career days at school. You see the policemen, the firemen, and now people in a lot of tech and STEM fields. But how many times does a male nurse go to be part of a career day? So they don't see people that look like them. And we all know that when you see someone who looks like you, it opens your eyes to the opportunities. That's certainly true where we've had limited number of females in certain positions, certain fields. Once you start having some females, others see that it's possible. So lack of role models is extremely important. The threat to masculinity, it's kind of a girly thing to want to be a nurse. And so what we find is that by high school, it's kind of too late to open their eyes to nursing. They've already made up their mind. It's too girly, and it's what sissies do. We need to go back to middle school, to where kids are a little bit more open to opportunities. But getting away from that idea that you can't be masculine and be a nurse is an important part. The idea that you're failed at being a doctor, you wanted to be a doctor, but you flunked out, but you couldn't come up with enough money to pursue a medical degree, and that you're not good enough, you're less than a doctor, is still pervasive. Interestingly enough, a number of men have told me that they had planned to go to medical school and saw nursing as a stepping stone, and then realized that they absolutely loved being a nurse and didn't want to be a doctor. So these are some of the areas where we can look at for recruitment. One of the things that I would point out, though, is that the literature, is quite international. You can read the same stories, the same research in Canada, in New Zealand, Australia. It's one of the few areas where there's a lot of men in nursing is the Middle East. And that's because many women aren't encouraged to work outside of the home. I taught in Jordan in the Middle East for a year, and it was quite eye-opening. They had so many men applying for nursing school that they actually had two separate tracks. One was a female-only track, and one was a female and male track, because they were trying to encourage more women to go in to nursing. So let's go to the next slide. So retention. There's an idea that male students drop out at a higher rate than female students, but I'm not sure it's really true. You don't usually see much in the way of statistics, but also, is it just a problem of small numbers? If you have only 2 males in a cohort and one drops out, wow, suddenly you have a 50% attrition rate. Well, you probably didn't lose half of the female students. And so sometimes just the small numbers distort your perception of a problem. So nonetheless, attrition of any student is not desirable. We clearly would like to admit the right students, we'd like to give them the right supports, and we'd like them all to graduate for a number of reasons. First of all, the student's perspective, it's wasted time and money if they don't graduate. And from the college's perspective, when you have a limited number of seats in nursing, which most programs do because of constraints of clinical placements and faculty, if you only have room for 40 students, you don't want to lose 10%, 20% of them. You'd like to make sure all of those seats produce another nurse. So attrition is clearly a concern no matter who attrits from the program. But I think we have to be careful about our statistics. I think sometimes the numbers are just too small for it to be real meaningful. So let's go on to the next slide. So now let's talk about some solutions. The next slide. Some of the recruitment strategies that are more of an overall focus is we need to inform guidance counselors about nursing as a career for men. And I've got some suggestions on how to do that as we go along a little further. The other is to break the stereotypes. Going back, it must be at least 10 years ago now, Johnson & Johnson had a whole series of ads about nursing as a career. it was a public service announcements, and the one that still resonates with me is there was a child in the bed, bald-headed, so clearly having cancer and chemo treatments. And a male nurse comes in prepared to give him something, and it was going to be in an IV line, so you didn't have a kid crying because they were getting a shot. And the male nurse was nurturing, cuddling type of behaviors, and the two of them sang a song together. It was clear this wasn't the first encounter, as the nurse came in and says, "So it's time for a Fee-Fi-Fo song," or whatever. And the two of them, the interaction was so meaningful that I couldn't imagine how anybody would want to be a nurse after watching that. But those public service announcements really made a difference in how people started to see male nurses. There had always been that sort of bumbling, meet the parents type of male nurse. And so this focused on what a real nurse was all about. So breaking the stereotypes that it's a girly thing to do. Providing access to men who are nurses. And the classic thing everybody says is you got to have some men on your faculty. That's what you need. Well, the reality is not everybody does have men on their faculty. And it doesn't mean that you can't provide role models. What you need to do is partner with your local hospitals. Get them to loan you a couple of their men, maybe even on company time where they're being paid to come over and work with you. Or maybe you need to give them a small stipend to come and spend some time with your nurses, particularly with your male students. But they need to see men who have been successful. And in clinicals, give them a chance, if at all possible, to work with a male nurse. And also providing accurate information, both to the guidance counselors, but also to prospective students, that it's evidence-based. It's not about being nice. It's not about fluffing pillows and carrying bedpans and giving medicines out. It's truly an evidence-based profession. People need to have a lot of knowledge. They need to keep up their education throughout their entire career. It's rigorous. We sometimes have people coming in thinking nursing's going to be easy. And I can tell you they often are tripped because it's not easy. So students need to come in really prepared for what they're going into. They need to understand the amount of salaries that are out there and to see the flexibility that you can work nights, you can work days, you can work in all kinds of settings. You can go back to school for nurse practitioner, nurse anesthesia. I mean, it's absolutely unlimited what the opportunities are. And a lot of different roles, administrative roles, tech support roles, a lot of advancements. So I think one of the most important things is once we actually just show people what's available in nursing, they're going to have a different perspective of it. So can we go to the next slide? So some longer term recruitment strategies. We need to start introducing younger boys, middle school, to the opportunities. Some places have had like boot camps for STEM, and nursing can tag on. Get the kids into your labs and let them fool around with the equipment and take blood pressures and things like that. Show them that it's a high-tech field as well as a nurturing, caring field. Making the guidance counselors aware. I'm just going to show this. I hope you'll be able to see it. Some of the hospital associations, particularly in the Midwest, going back a number of years ago, did calendars like this. And every page is a male nurse and a picture of him in his work setting, and then a picture of him in his other setting, his life setting. And being in the Midwest, there's hunters and fishermen, people that are competitive bikers and things like that. But to show the realistic look of men in nursing. And you say, oh, a calendar, that's an expensive proposition. It's not really. I did an alumni calendar when I was at Mount St. Mary, and it really wasn't that expensive. And what I like about calendars for guidance counselors is that every month of the year, they're still seeing you. You know, if you send them literature, it goes in a pile on their desk, and then it gets moved to another pile, and then eventually it goes to the circular file. But a calendar is in their face all the time, reminding them. And partnering with hospitals and other healthcare agencies to identify employees who have the potential to become a nurse, somebody who's working as a phlebotomist or some kind of lower level tech type support, or a nurse's aide, an orderly, an OR tech, and help the hospitals in your local area to see that this is growing their own. They may be doing it on a formal basis. They may be doing it with just one or two as a trial, but it's something to use as your long-term recruitment. That probably won't fill your class next year, but if you get middle school kids to think about nursing as a career, you may see them in 4 or 5 years knocking on your door to become nurses. So the next slide. So when you're thinking about how you market your program, think about some of the practical things. What does your website look like? What pictures do you show of nurses and nursing students? One of my pet peeves is when I see them pictures of female nursing students or nurses and their hair's hanging all over the place. That's not the way nurses are supposed to look. They're supposed to look tidy. Every time a nurse hangs their hair over an open wound, I totally freak out. I'm sorry. But think about the pictures. Are they pink and are they girly, and do they have teddy bears in them and look cuddly? Or do they have a lot of blue and some men in it, some diversity? Nurses come in all shapes and sizes. They have tattoos. They aren't all looking alike. So show them for who they really are. How have you promoted your nursing program to local guidance counselors? Do they even know who you are? Had anybody from the nursing program ever gone and talked to them? And I know that most of the community colleges tend to be more local. It's not like a major university where you're recruiting from across the country. So it's, I think, a little bit easier. Find out if the guidance counselors have an annual meeting of a bunch of guidance counselors and see if you can get on the agenda for 20 minutes to talk about nursing. Have you involved any of your male nursing alums? The men in nursing, I think, are extremely supportive of other men in nursing. So giving them the opportunity to talk about the program, be the face of your program. And what about the media? Especially if you're in a more rural area, your local newspaper is craving news. I have to say, we were so lucky in Newburgh because the local paper there published things about the college all the time, but particularly about the nursing program, because they were interested in nursing, but we sold them on that. And anything nursing did, we made sure that we put out a press release, things like that. So those are some of the things that your marketing can do when you partner with people across your community college setting for that. And then on the next slide, I think, yeah. When I was at Curry College, which is just outside of Boston, we finally convinced the college publications department to do an article on men in nursing. And so as you see, it's very blue. He looks satisfied to be a nurse. He looks very masculine. And so that kind of constant put it out there of how we can show that men are nurses. It's a slow process, but the more everybody does it, the more it becomes the norm. So the next one. So some short-term retention strategies. Find the men nurses who can be role models and find a way to get them involved with your students. And also partnering with local hospitals to encourage their male nurses to work with your students. So they've got to see somebody who looks like them, who encourages them, because nursing is tough. Nursing school is very tough, and all students get discouraged partway through. But the male students are often hesitant to reach out, particularly to faculty, to female faculty, who maybe weren't as welcoming to start with. And so they have to prove themselves. And so they're not as able to always ask for help as some of the women are. And then the next slide. I think we have just one or two more. So opportunities for men to socialize with other men in nursing. If you can find a time where men in the program across different cohorts can get together, it gives a great opportunity for the beginning students to see somebody who survived the first year. And so to bring them across cohorts or bring alums back is really important. And give them opportunities to share their perspectives on the program. And particularly exit interviews for any male who leaves the program. Find out why they left. Was it the way the program was run? One of the things that men often have trouble with is their clinical rotations, where they may be uncomfortable with things like the intimate touch that they have to do, particularly in obstetrics. So look for ways to support them at critical points where they're going to be particularly stressed. And I would say obstetrics is probably their most difficult rotation. And the second most difficult is fundamentals, where they, for the first time ever, have touched people in a different way. But I think exit interviews to find out why people leave are extremely important. And then appropriate faculty behavior and support is important. I've had men tell me that when they were in a program, they had a faculty member tell them, "I'll do everything I can to make sure you won't graduate." Now, this is quite a while ago, but some faculty don't really support the men. And we need to, I think, be careful and watch for faculty behavior that's less than supportive for any student, whether it be a minority student, whether it be a male student or a female student. It doesn't matter, but I think anybody who's at the head of a program needs to be particularly aware of problems with faculty and help them to change their behavior to be more welcoming. The American Association for the Men in Nursing has a student membership, and they have scholarships, they have chances for mentoring and things like that. So to introduce the students to an opportunity, and that is very carefully named. It's the Association for Men in Nursing, not of Men in Nursing. I've been on the board and been welcomed there, and it's got chapters throughout the country, most of which are at more of the larger universities because they have the critical mass of men. But a student can join for $30, I think it is. Might even be only $15 for students. And it gives them an opportunity to have a connection, even if it's only a virtual connection at this point. And then I think we have maybe one more slide. Yeah. So this is a group of men, nursing students. The only two who are not nursing students are the two on the right with a tie. The one in the front with the tie was an alum of Mount St. Mary. He worked at St. Luke's Hospital, which was about a half-mile away. And he made himself available for a night where the guys had pizza and a chat about their careers and where they were and things like that. The other one, I believe, came also from the hospital. I don't recognize them, no, and I don't know if he was an alum. But, you know, from my budget as a dean, I basically paid for some pizzas and sodas and gave these guys a chance. These were mostly ones that were in the accelerated program, but gave them a chance to, on a more informal basis, talk to each other about their careers, get some advice from two very successful nurses, and just feel a little bit more a part of something. You can do that. So let's open the floor. What kind of questions do you have? What ideas do you have for recruitment and retention?
Thank you so much, Dr. LaRocco. Anybody can unmute and talk to Dr. LaRocco. So while people are thinking, I can throw out a question for you, Dr. LaRocco. At the Center for Women in Government and the NET program in particular, we are currently doing research on pedagogical practices and curriculum reform that would help manage the space in the classroom and campus spaces to make it more, inclusive, and to avoid some of what the literature tells us about challenges that students who are pursuing gender non-traditional fields of study face. For example, the loneliness, the isolation, the sense of belonging. It doesn't seem like you feel that nursing has many of that, but maybe from a historical perspective, the gendered language that is included. Anti-male remarks, for example, stereotypes as less caring, for example, the communication style differences of women and men, and men may be considered less empathetic or less caring. So you brought up the faculty angle, and we've been hearing from focus groups that, many faculty do not have the ability to teach. We know that they're subject matter experts, but we don't necessarily teach them how to teach. Yes. And so in terms of professional development, in your experience for faculty, what is needed, and how can you mainstream diversity and inclusion perhaps in existing curriculum?
I think that's a very tough question, but let me have a little bit of a go at it. In nursing, one of the first things is stop saying she all the time. Mm-hmm. And even in test questions, typically the nurse and then the next sentence will be she. So we've tried to be more inclusive, and the nurse is sometimes the nurse, and he being mm-hmm. the gender piece. I think sometimes we need more of an attitude change than anything, is for particularly, and I'll say this, which isn't popular, but some of the older nurses, and I am an older nurse, so I guess I could say that, but they were not convinced that men belonged in nursing. And I think we've moved past that to a large extent, that they're at least accepting that men belong in nursing. There's a lot of criticism, though, that men all want to go into ER, OR, or critical care. Well, so who cares? If that's where they want to go, it doesn't make them bad people. So we need to stop sort of stereotyping what a male nurse is going to be like, and let them be a person first, and then they just happen to be male. They range the whole spectrum, male nurses, just as female nurses do, from very gentle, caring people to a little bit tougher, but there's room for all of us in nursing. If you work in rehab and you're too quick to help somebody, you're not helping them. You need to be sometimes the meanie. You need to stand there and say, no, I'm not going to help you. You can do that. And so nursing has room for all personality types, for all styles, in different styles and different settings. Myself, I always say when I grow up, I want to be a hospice nurse. I love taking care of dying people.
Mm.
I hate going to codes. I hate the drama and all that excitement and pizzazz that some people love. That's not where I belong. But so we need to also look for ways to be more supportive of the person who they are, not the person we think they should be. And I agree 100% with you that we do not do a good job with faculty in terms of teaching them how to teach.
Mhm.
So I think it's challenging. There has been a huge movement in textbooks to get away from everything being pink and girly and all. I'm in the midst of editing an 11th edition of a health promotion book. And that's one of the things we're looking very carefully at in this edition to make sure that our pictures show diversity, that our language is more neutral. And so I think we're moving in the right direction. We're just not moving quickly enough for me.
So, thank you, Dr. LaRocco. Anybody else answering Dr. LaRocco's question? Any ideas about recruitment and retention of male nurses?
Go
Go
ahead,
ahead,
Michelle.
Shan.
Hi, I just wanted to thank you for this presentation and also, piggyback onto what you said about changing their minds early about, in middle school and what they need to do. And that's some of the efforts that we've actually done in our whole college is getting out to middle school students in many ways versus events at their school or bringing them in here for Saturday or evening programs. And, listening to what you said too, I like thinking, making sure that what we're doing, that we show them isn't just the art of caring, but it's the science of nursing too. And we have them here and having them. So, one of the activities that one of our faculty does is really turn on our simulators and get out the stethoscopes right away and show them what they're going to be doing. But I'm thinking of other things too, is having posters and some advertising kind of around that highlights some of the male nurses. And we have a couple really great ones in the area. Also, we've been very fortunate, and I'm not sure if everybody's aware of the Vanguard Award. I see Dina shaking her head, but we've been very fortunate. We have submitted, our faculty have submitted in the last 4 years, I believe we've had, which is an award for a non-traditional by gender student. And we've had 4 males win that in the last 4 years. And we actually highlight that on our website too. There's a link to that. So it goes right to that article about that student. They were written up in our alumni magazine also. So that's been a great way for us to really highlight some of the successful male graduates we've had in our program. So thank you.
So important. You need to do all these things all the time. And some will be on top of your list today and others a different day. But the important thing is you never stop saying, how can we showcase
Right.
our male students? Because people forget very quickly. I can't tell you, though, how important it is for guidance counselors to be more aware.
Mhm.
I think that's critically important.
Mhm. And is any of the institutions that are represented here, do you do any work with the guidance counselors in your local area, your region? Melissa?
Yeah, so at Hudson Valley, we actually invite the guidance counselors on campus once a year. And we have a really good rapport with our local guidance counselors, and we highlight different programs. So every time we invite them on, we might highlight an academic program that either is new or something they haven't heard about in a while. Or we might, like this coming March, we're going to talk about services that we offer students on campus because they're not always aware of support services that they can do. But that's a great idea. We can certainly incorporate. The hard part with nursing is we don't always incorporate it in a marketing campaign because we're flooded with applicants and we have more
Yeah.
than we know what to do with.
Good problem to have, right?
Yeah, it is. I mean, when you're in the SUNY system in New York State and you're almost the lowest tuition and you have 96% pass rates, then yeah, you end up with a lot of people. So it's great, but I agree. I do think we need to do more. We also go out to our local Capital Region BOCES, our VOTEC Center. They have a regional fair where they invite all the nursing programs in the area. And I very rarely, there are a few men in their program, but not a lot. And, it would be nice to be able to do something special for that population. It's hard. And to be honest with you, I'm on the admissions side, so I don't see how many they're teaching. Once we get past the point of acceptance, they're in the program. I don't see the retention piece to see if we actually keep them or not, because we have other allied health programs like respiratory and paramedic and other programs where we are getting more males into those programs. But yeah, nursing it's tough. And it's not,
Well,
not for lack of trying.
When you have so many applicants and then you say, well, but we want to try and recruit more men, people look at you and say, but you have so many applicants. Why are you messing with, you already can't take all that want to come. Why are you looking for more? So it's kind of a funny problem to have.
It is, and you're always looking for diversity. I mean, we just started a couple of years ago, we started offering a 1-year advanced program. And I think we've gotten more males in that program because it's geared towards people that have a bachelor's degree already. So, they might have a degree in bio or something like that. But I think about, like, my son's a senior in high school and one of his classmates has applied to our program, but our entrance test, using the HESI exam, it knocks candidates out because they're not great test takers, so.
Yeah. But there is still, I think, better to knock someone out as a candidate and help them get more prepared than to get them into the program and have them fail out, because that's, first of all, devastating to them personally. Then you've got that empty spot that's hard to fill after the first semester. And and it's really rigorous. So your students need to be well prepared.
Right. Yeah. And they are. I mean, they do well in the program, and that's the reason why we went to an entrance test in 2008, because our retention wasn't good. We were doing first come, first serve, and it was tough. So, but all of these have been, I appreciate your presentation because it's, things that I don't always think of on a daily basis. I mean, we talk about, with education, trying to get more males into education, especially early childhood. It's not something where we have a lot of males. And we talk about those things, but I don't know, we don't think about nursing. We just think about, we always fill our class, and that's the thing that's important, the most important thing to do here,
And that's a good segue to, excuse me, to an issue that you brought up about early childhood education. There's a lot of lessons we can learn from nursing. Nursing is really a success story as a profession, because it really it moved from the art of caring to the science of nursing, and it professionalized. And that's why it has such high salaries that even you, Dr. LaRocca, find really impressive. It wasn't like that, right? And so it went through a journey. And what do we learn from the nursing profession that we can replicate in early childhood education? We were talking to early childhood educators, and they tell us, the enrollment for women we're struggling to enroll women, not alone men. So, because the salaries are so low, it's still a profession that is not quote unquote professionalized yet, and didn't go through the path that nursing went through advocacy, public policy interventions, and education professionalization, and all of that. What can we learn from nursing and its success story that we can take over to the early childhood education field?
I can chime in right there, Dina.
Sure, please,
I
yeah.
actually just received kind of like a showcase or a highlight on a student from BMCC who just won the Vanguard Award. And older gentleman who decided to just change fields and go back into early childhood education. It's a wonderful story. The grant liaison from BMCC shared it with me just yesterday. So I can actually share you the link of the newsletter, and I can provide it to you, Dina. And then if you wanted to just share it with the group, that
Yeah,
might be something that's
absolutely.
helpful. It was wonderful to
Absolutely.
read.
Yeah, absolutely.
Yeah.
Thanks, Sarah. And so it was a second career for him.
It was. It's pretty
Yeah.
interesting on where he
Yeah.
started when you
Yeah.
read the article, but yes. Yeah.
Right, right. Yeah, that's amazing. Yeah, so any thoughts, Dr. LaRocco, on any lessons that we've learned? Obviously, there has to be a lot of advocacy that is not happening at the early childhood education level.
I'm not sure how nursing managed to improve salaries so much. I think unionization in some places did make a big difference. There are a number of hospitals that have unionized,
Yeah.
and then other hospitals in the area have to raise their salaries to compete. So supply and demand definitely was a factor, but I think the unionization did make a difference.
Yeah, so the early child education, and I can't wait to read the newsletter, Kara, is still, we need it. The demand is there. We know that women cannot and families cannot function without childcare, but the salaries are still very low and the supply is not there.
Yeah.
So yeah, it's a dilemma for sure. But I'm gonna open it up again for other questions, other comments, remarks. Esther, go ahead, Esther.
Oh, sorry. I know, Dr. LaRocco, you're talking about the importance of like informing, like the information, or how guidance counselors should be familiar with the career or like nursing. But I think it's important for, I know that there's a lot of like articles, the research discuss the importance of, male nurses. But like, in your opinion, what like unique perspectives or like the qualities do this like male nursing student can bring to the profession? Just curious.
I think one of the things that males bring to the profession isn't so much a quality of them as a group, but their ability to speak to other men, particularly on issues related to men's health. And I have to say, the American Association for Men in Nursing has made that kind of their subset, is men's health. First of all, men's health is somewhat ignored oftentimes in the nursing curriculum. And secondly, a lot of men don't access the healthcare system until they really need it. They're not as quick to go for routine checkups and things like that. And so one of the things men, I think, in nursing, male nurses bring to the table is more of a comfort level for male patients, or male people who aren't patients but who should be accessing. Some of the chapters of AAMN do things like the guys will get together and set up a blood pressure screening at a football game, a college football game. And as guys go by, they'll grab them and say, "Have you had your blood pressure taken?" Whereas what I used to tell my students is, it's okay to use your personal qualities to improve healthcare.
Yeah.
And so just as perhaps a young woman, particularly from a different culture, might be uncomfortable talking to a male nurse, many young men don't want to talk to a young woman about their healthcare problems. So one of the things I think that's really important is that they they bring themselves to the table. I also think there's definitely differences in how problems are approached. Not to imply that men are rational and women are not, but there's just sometimes a different thinking set that just enhances the work environment to have more variety, whether it be variety in gender, variety in ethnicity and background. You think differently when you're in a group that's not all like you.
Mhm.
So I think that's one of the things that really makes a difference.
Yeah, you get over that group thinking and
But one of the male faculty, he was a member of the American Association for Men in Nursing. He and I would often have a discussion about how to treat students. And I would tell him that once the student closed my door, anything they said was private, tears were okay, and I went through a box of Kleenex every semester. And said he has a sign on his door that says it's a no cry zone, and he tells them there's nothing to cry about. So, I mean, we had a totally different approach. Is one right or wrong? No. But
Mhm.
each student, if we worked in the same place, would gravitate towards the one that made the best approach for them.
Right.
He used to say that I let him become whiny and complaining, and I said, you're too mean. But neither was right, neither was wrong. We both had students that came to us because we were their support.
Right.
They probably would be different students, but you need that variety so that students can find their support, just as patients can find the nurse that helps them the most. So,
Yeah, provide something for everybody. Yeah.
mhm.
Any questions? Any comments? In answering your question about ideas for recruitment, one of the ideas that often comes up is the recruitment. You mentioned the recruitment from inside the healthcare field, the healthcare industry, but also what about recruitment from special populations that are not really tapped effectively? So special population in the Perkins Act are defined as populations include unhoused people, veterans, pregnant women, disconnected youth, English language learners, new immigrants. Do you have any thoughts on that, Dr. LaRocco? And have you encountered strategies in your work that really try to look outside the box of where to recruit?
I have not really been involved in recruiting in these special populations you're describing. There have been programs specifically for veterans,
Yes.
who, particularly medics, trying to show them the path to nursing as an option. Some
Right.
schools have actually recruited them as a cohort.
Yeah.
Years ago in New York City, there was a rash of firefighters retiring at very early ages. And I believe one of the hospitals or one of the colleges, might have even been one of the CUNYs, set up a program specific for firefighters, most of whom were EMTs themselves anyway, to move through as a cohort with that support for each other. So I think anytime you recruit to a more underserved population,
Mhm.
you need to try and recruit a core of people, because being one of a kind is difficult. No matter what you are, one of a kind, whether you're the only woman on a board of 10 men or the only male faculty in a nursing program, it's hard to be a one of a kind. So I think that there should be an attempt to bring in at least several of whatever it is that you're trying to recruit.
Very good point. Very good point. And I would think that you would also need an on-ramping or, a program that would prepare.
If you bring in people who are not well prepared for the rigor of nursing, you need the supports for them.
Mhm.
You
And
don't need to wait till they fail or till they're struggling. You need the support right from day one.
And what would that support system look like? It would be a pre-nursing program? Or-
It may be
Yeah.
nursing, that they need to catch up in their sciences. It may be tutoring along the way. It may be
Mhm.
more financial support. One of my biggest problems at one university where I was the dean was the fact that most of my students worked a lot of hours.
Mm.
They were smart, but they couldn't put the time into their studies. And what they needed was more financial support so that they could have the time.
Right.
So to bring people in and say, kind of sink or swim, that's a
Mhm.
problem. You
Yeah.
need to say, you might not be at the level you should be, so we're going to help you get there so you can be successful. We
Mhm.
can't lower the bar because we have a licensing exam at the
Exactly.
end,
Exactly.
but we can help people make it over that bar.
Right.
And I think that is what we really need to focus on, not
Yeah.
just dropping people in and letting them sink or swim. That is
Right.
so
Right. Setting them up for failure, really.
absolutely.
So any of the institutions have recruited from special population, underserved population? Do you have an experience you want to share with us? Yeah. Melissa? Oh, we can't. Oh,
It might be delayed. Is it coming? Can you hear me
yes,
now? Okay.
we can
Yeah,
hear you.
for some reason, the microphone starts picking me up after I start talking, and I have a brand new computer. So my apologies for the trouble today.
Not a problem.
We participate in the Educational Opportunity Program. I think some of my other colleagues who are on the phone, this meeting, do as well. And so through that program, we do have extra funding and extra support for our students that come in, and we do admit students who are underprepared into the nursing programs. And then we have other student support services across campus, you know, like tutoring, the federal TRIO grant. We have C-STEP. And so these programs do help support with you know, textbook fees, the codes for the nursing materials, the fees for the exams. And so we do try to lend that, you know, extra support.
Mhm.
I've enjoyed today. I appreciate this. I guess it's like a quick funny story, but I really related to the point about the male advisory group. I think that'd be something we could implement here that would help. I remember I used to work at Albany Med, and I, at the time, was the same age as a lot of the students. I did financial counseling for them. And it's kind of a long story, playing basketball. I befriended some of these people. This gentleman was telling us this story about the first time he had to perform an exam on a woman. And it made me stop and think in this presentation that maybe we take for granted, like our healthcare is much more invasive at an early age, and that could be very intimidating for men because their invasiveness usually comes at a later age, right? So this gentleman is telling this story about how he walked in to do everything proper and the hand sanitizer machine malfunctioned, and so he got like a lot of extra. And so he said he sat there and talked to this woman and tried to get rid of. And so like this, like he just felt awful, like rubbing his hands like he was preparing for this exam. And he said it was so embarrassing for him that, you know, this moment had never quite left him. And it just made me think about your comment today in that story, that I think that's a spot that we can do better in here at Canton. And our team, I'm in charge of enrollment here. We go out recruiting. Maybe we need to bring up some of those conversations and funny stories, because there's probably people sitting there in the audience thinking, well, this is a career I might go into, but I can't seem to get past maybe these fears that I have. And so maybe we can use some light humor and just actually broach the subject rather than just saying, do you have questions? Because most people, a lot, even in webinars like this, people are a little reluctant to speak. So I'm thinking we're missing people who are probably interested, but maybe they have, you know, some barriers in their own mind that they have to get past. And we do not have a large representation of males in our nursing programs. In fact, I was pulling up the stats for all of our nursing programs just to review them while the webinar was going on. And we have a lot of work that we could do to help increase the males in nursing. We also have early childhood here on our campus as well. So it was funny that that comment came out. That's also obviously very female dominated. And then we have other Perkins programs here that are very male dominated with our engineering programs that need more women. So we have the same issue just in, you know, different programs.
One
Awesome.
of the things that when I think about faculty too, is we need to give our students, all our students, but particularly the male students, I think, a chance to practice things in the simulation lab. I mean, you don't really think about having to teach a student how to touch a person, but a young male who's now having to touch another person in a way that he's never done that before, whereas young girls tend to have had more contact in touching than young boys. And so one of my colleagues who I've known for years from the Men in Nursing organization did a lot of research on teaching male students how to touch and how to feel comfortable with intimate touching. And intimate isn't only the intimate body parts, it's simply things like washing another person. That level of touching is not intuitive. And so you can teach it in the lab of, you know, you fold the washcloth this way and you soap it that way, and you start at the face, you don't start at the feet. That's all technical stuff. But to teach a person to be comfortable with it, and we need to make sure that our faculty are sensitive to that the faculty take the time to read the student and where they're at and help them get to the level they need to be. I used to have an exercise with my fundamental students the week before we went to our first clinical. And what I would teach them, all of them, men and women, was that you had to learn how to ask questions about intimate body things. And the students always have trouble asking a patient, did you move your bowels? It's not what we do in real life. I mean, I'm not going to ask any of you if you moved your bowels today, but I ask my patients that all the time. And so I would teach them that you needed to learn how to say that in the same tone of voice, at the same comfort level as you ask, what did you eat yesterday? Because if it comes in, it's got to go out. And so I would make my students in a group, we'd be sitting around the table, each one would have to ask me, did you move your bowels? And each one got a different answer. And they would be frozen, just absolutely frozen. And I'd say, we're not going anywhere till everybody does this. So who's next? But you know, you had to work with them. And then what I would watch for is how comfortable they were. And the ones that I could see were less comfortable, I would work with them the next week in the clinical setting. You know, we practice a little bit more before we go into the room. Maybe the first time we had to ask a patient, I would ask and let them see how I did it. But you have to read those students so that you can help each one move up from where they are, because they're not all in the same place.
And are there aspects of the touch that has to do with fears of being suspected by others? And how do you diffuse that fear in a classroom?
Well, I think you do it in the lab by helping them think about, why are you touching this person? What's the meaning of this touch? Is it to clean them? Is it to comfort them? And so looking at your motivation for touch, and how do I translate my motivation into something that other people, and asking to, and I do this with students all the time, I might say to them, you look like you need a hug. Do you want one? I
Hmm.
don't just hug my student who needs a hug. I wait for
Ask.
them to tell me. So
Yeah.
to ask them, help a student, all students, to see that a touch of a person's hand can be calming and feel good. But I always tell the students a story that a mistake I made of trying to shake hands with a person who was very religious, Orthodox Jewish, and didn't shake hands with women. My hand was out there, but
Yeah.
I wanted to shove it back in my pocket and never let it out again. So sharing with them that sometimes you're going to make a mistake.
Yeah.
And then you say, I'm sorry.
Right.
That's all.
Yeah.
But you know, you've got to look though where a student is to get them where they need to go, because they're all at different spots.
Okay, we are
We're
out of time. So all we have to do now is thank Dr. Susan LaRocco for her insightful and enlightening conversation. Thank you so, so very much. This has been wonderful information that you shared with us. You gave us a lot of food for
my
thought.
pleasure.
And for everybody who is here, please look out for the webinar recording, which we will upload at the website, the NET website, www.netprogram.org. Thank you again so much.
And my email contact information is on the first slide. If you want to talk about this, any ideas, any questions, don't hesitate to contact me.
Thank you
And
so
thank
much,
you for
Dr.
inviting me.
Thank you for your generous offer. Take care, everybody.
Thank
See you
you.
later.
Bye-bye.